Hello everyone. Today's our topic is about liver. Let us see about liver anatomy, the functions of the liver and the signs of liver insufficiency, liver function tests, and few diseases like cirrhosis and obstructive jaundice and their anesthetic implications, and finally into liver transplant surgery and its anesthetic implications. Okay. Firstly, about liver anatomy. Liver is the largest gland in the body, weighing about 1.5 kg. So it has five surfaces. Just imagine the liver in your hand. It will be having an anterior, posterior, superior and inferior and the right surface. Okay. This liver is divided into two lobes. This is anatomical division. Please remember that. This is different from surgical segment divisions that we'll learn later. So right and left lobe, and this division, the right and left lobe, is by falciform ligament, fissures for ligamentum teres and ligamentum venosum. So these two lobes are finally divided into lobules and the liver cells hepatocytes. Among the right and left, obviously right is larger and it has caudate and quadrate lobe. There is a thing called porta hepatis, which is nothing but deep transverse fissure in the inferior surface of the right lobe of the liver. And it has portal vein, hepatic artery, and hepatic plexus of nerves entering into it, while hepatic ducts and lymphatics leave the porta hepatis. Coming to blood supply of the liver, we all know that liver has dual blood supply, that is hepatic artery and the portal vein. Let's see them. The portal vein, the blood from the portal vein, it enters into the interlobular veins and finally into the sinusoids, which is a very important site of communication among the arterial inflow or the venous outflow or the hepatocytes. Let us learn it later. And from sinusoids, the blood is drained into central vein and finally into hepatic vein, which in turn drains into your IVC. Coming to hepatic artery, the branches of these hepatic arteries, they accompany the branches of portal vein, and there is no anastomosis between the branches of hepatic artery. So each artery branch is an end artery. Coming to hepatic vein, the divisions of hepatic vein are right, middle and left. And this drain blood from central vein to IVC. So this is like a bridging thing. Coming to sinusoids, it is an important site of communication between, I have told everything. The portal inflows, biliary system, venous outflow, and all those with hepatocytes. So, for this communication to be maintained, there has to be some special features in the sinusoids, right? So, it has two things. One is a larger fenestration, and the second thing is it secretes an intrinsic vasodilator, nitric oxide. So, the endothelium, these large fenestrations, they help with the intimate contact, and this is how the constituents of the blood enter in the hepatocytes, and there the transformations, modifications, metabolism, whatever, everything takes place. Secondly, the intrinsic vasodilator, nitric oxide, it helps in the vasodilatation of the hepatic sinusoids, so the pressure decreases. So there is a pressure gradient between the portal circulation and the systemic circulation. So this helps in the communication too. Coming to the contribution of hepatic artery and portal vein to the blood flow to the liver and also to the oxygen supply. So among portal vein and hepatic artery, portal vein contributes more, which is about 75 to 80%, and the remaining 20 to 25 is by hepatic artery, blood flow wise. Whereas if we come to oxygen supply, hepatic artery is almost 30 to 50% and the portal vein is 50 to 70%. Lastly, the lymphatic drainage. It is into superficial lymphatics and deep lymphatics. These lymphatics in turn drain into the surrounding lymph nodes, like the superficial into your caval, hepatic and celiac lymph nodes or directly into the thoracic duct, whereas deep lymph nodes, lymphatics around the nodes of IVC and hepatic nodes. Nerve supply is hepatic plexus of nerves, which has both the components, obviously the sympathetic and the parasympathetic fibers. Liver has its own reticuloendothelial system in the form of Kupffer cells, which are nothing but your macrophages around the endothelium of the sinusoids in an interval manner. Okay. And finally, the bile, which is formed in the tiny vacuoles in the hepatocytes, they enter the canaliculi and from there into intralobular and interlobular bile ducts and finally into right and left hepatic ducts, which later form your common hepatic duct. Okay, so these are about the blood supply, lymphatic drainage, nerve supply, and about the bile. The special features of the liver are it has a good physiological reserve, and also the main thing is your regenerative power. So if you do a hepatectomy, if you want to remove a part of the liver in a healthy individual, the remaining part does the whole work. So this is why your transplants are possible even there is a single liver in a human body. So these are the surgical segments of the liver. So liver is divided into right and left hemiliver, and this right into posterior and anterior sections and left into medial and lateral. The right one has 5, 6, 7, 8 segments, whereas the left one has 2, 3, 4, and 4 is again divided into 4A and 4B. And the first segment is your caudate lobe. It is a separate segment and which is totally posterior. We can't see it from the anterior view. Okay. So coming to the full terminologies, hepatic lobule, portal lobule, and liver acinas. No need to by heart this. Let us see into picture. We all know that hepatic lobule is hexagonal, right? So each corner is formed by your portal triad. And this portal triad has hepatic artery, portal vein, and bile duct. And the center is formed by central vein. So this is your hepatic lobule. Hexagonal, corners by portal triad, center is by central vein. Okay. Now coming to portal lobule. Portal lobule is triangular in shape. Okay. Joining the adjacent central veins. That is, this is one portal lobule. Okay. So this triangle, the corners are formed by central veins, whereas the center is formed by a portal triad. So this is the difference between both of them. Coming to hepatic acinus, it is nothing but the liver parenchyma between adjacent central veins and around the pre-terminal region, pre-terminal branch of hepatic artery. So between adjacent central veins and the area around the pre-terminal branch of hepatic artery. And this zone is again, this place is again divided into 3 zones. Okay, zone 1 is near to your hepatic artery branch and zone 3 is near to central vein. So this is less prone for hypoxia because of artery supply. It is near to the oxygenated supply, whereas zone 3 is more prone for hypoxia. Zone 2 is intermediate. Okay. So now let us see. Hepatic lobules, we have already learned the corners are the portal radicals or portal triads and center is the central vein. And from the central vein, the hepatocytes are lined in the form of lamina. Coming to portal lobule, it is triangular in shape. The sides are by central veins and the portal triad at the center. Liver and sinus, it is the functional unit and it is the parenchyma around the pre-terminal branch of the hepatic artery between the two adjacent central veins. So, coming to each zones, the zone 1 is closer to the oxygenated supply. So, better supplied with oxygen, but it is more vulnerable to the hepatotoxins that are circulating in the blood. Okay. And zone 3 is close to the central vein, more prone to hypoxia. So, in zone 1, there are phase 2 reactions. And in zone 3, phase 1 reactions takes place. Don't get confused with zone 1 and phase 1. In zone 1, it is phase 2, not phase 1. 1 is not for 1. Zone 1, phase 2. So the remaining zone 3 is phase 1 reactions. The phase 1 reactions are oxidation, reduction and hydrolysis, and the phase 2 reactions are your acetylation, sulfonation and glucuronation. So this is in brief about your liver anatomy. Okay.